All right. So having done talking about the single types of diuretic drugs, we now want to start talking about combination therapies. All right. So for this combination therapy, we'll be talking about one which is known as what? Aldactazide. Aldactazide. So aldactazide is also known as what? Like a combination of what? Spironolactone, hydrochlorothiazide. You combine these two drugs together. So aldactazide, you say that it's a combination diuretic. It blends two agents with complementary actions. Spironolactone, we discussed it earlier on as a single agent. We said that it's a potassium-sparing diuretic. Hydrochlorothiazide is a thiazide diuretic. You understand? So together now, they will complement each other to make sure that what treatment is effective. So talking about the mechanism of action, of course, you have to now discuss the two drugs. So spironolactone antagonizes what? Aldosterone at the distal renal tubules. This now inhibits how sodium and potassium is actually coming back into the body. Do you understand? Okay, it's potassium sparing. This one is to inhibit sodium coming back into the body, but to stop potassium from going out. Do you understand? Just be getting the whole gist. While hydrochlorothiazide inhibits sodium chloride symporter in the distal convoluted tubule, it will now promote excretion of sodium, that's chloride and water. So when you combine them together, it will lead to what? Enhanced natriuresis and diuresis, reduce plasma volume and blood pressure. Alright, so potassium conservation due to spironolactone actions. Alright, so pharmacokinetics, onset of action is about 2 hours, duration is about 6 to 12 hours. Okay, excretion, renal for hydrochlorothiazide, hepatic metabolism, and renal excretion for also spironolactone. So they can be used together as a combination therapy to treat hypertension, edema from heart failure, liver cirrhosis, or nephrotic syndrome. Yes, potassium sparing strategy, right? That's in patients that you know that they will lose too much potassium. So you now use spironolactone basically to just spare it. So precautions: hyperkalemia risks, especially in renal impairment or when combined with what? Angiotensin converting enzyme inhibitors. Can cause electrolyte imbalances like what? Hyponatremia, hypochloremia. Can cause gynecomastia and menstrual irregularities. So it shouldn't be used in people that their urination is not really good, So acute renal insufficiency and hyperkalemia. Right? So that's it for aldactazide. Alright? Aldactazide.